about some of the factors here and family background, because from so many people, I hear it's in my genes. And I'll go back again to the cartoon era of Eric Cartman in South Park, who screams, "I'm not fat, I'm big boned."
Right.
Okay, so how much of this is reality?
So, well, definitely what we like to think about in obesity medicine is that there's a microenvironment and a macroenvironment that definitely influences what we weigh, and there's absolutely some what are called monogenetic causes for obesity, and those are not the majority of cases. The majority of cases, the obesity is accumulated over time. The majority of cases, it's lifelong influences in your culture, in your food habits, in the way that you were taught to eat, in how our culture has developed socially, and how we live our lives and have decreasing levels of mobility and energy expenditure as we've gotten older. There's, and I would encourage you to look at these statistics because they're pretty easy to find. If you look at a world map, this isn't unique to the United States, although we may think that it is. There's actually countries that are dealing with this epidemic just as much as we are, and there's a lot of things that influence that. So again, there's multiple parts of this disease. There are multiple things that can be reviewed so that we can try to, again, implement your nutritional plan, your obesity plan, and then be able to help treat you better. So there's a lot of levels of treatment.
So out of these, genes and family background, metabolism, age, medicines, sleep.
Correct.
Any other risk factors we're missing in here, or which one should we pull out? We just talked about genes and family background.
So a very easy one to pull out of there is medicines, for example. That's a really, really simple thing that I do in an initial consultation when we sit down to talk about your weight. What medications are you taking? What medications have you taken that may be influencing what you weigh? Or it may be even, how about this, inhibiting your ability to lose weight?